Treatable. Really, it's treatable. Yes, it's treatable. It's the Treatable podcast. Say what's on your mind. It's the Treatable podcast. Real, coming, treatable. It's the Treatable podcast. It's all on the Treatable podcast.
If you've been in a relationship before, chances are you've heard the term boundaries. But what exactly is a boundary? Is it a statement, a belief, or a demand that you can make of someone? And why do we need boundaries anyway? Can they really help us have better connections with people? In today's episode, we're answering these questions and more. So let's dive in. Welcome to Treatable, the podcast where we unpack mental health topics with experts who show us that change is possible. I'm your host, Clint Malley, and today we're unraveling what boundaries really are and how to set them so that you can have more meaningful, healthy relationships. Joining us for this discussion is Catherine G. Cleveland. Catherine is a PhD-trained licensed mental health counselor who's deeply passionate about helping people with their personal challenges. On her mission to make mental health and well-being topics reach a broader audience, she's authored several practice-informed mental health books. She's also developed the Cleveland Emotional Health Residency program for master's and PhD level graduates.
Treatable podcast. It's all on the Treatable podcast.
Catherine, thank you so much for joining me on the podcast today.
Thank you so much for having me, Clint.
So we're talking about boundary setting, and what I like to do for listeners is to give them a general understanding of the topic in a way that anybody could understand, maybe even if we were talking to a 7-year-old. How would you define what boundaries are and why they're important?
So boundaries are pretty much what we're okay with and what we're not okay with. There are values, and they're important because it helps us have really better relationships with ourselves and with other people.
So they're like these lines in the sand that we draw between ourselves and the rest of the world. On one side of the line, these are the things I'm okay with. And on the other side of the line are things I'm not okay with. And how and where we draw these lines are determined by our personal values, right? So if somebody were trying to understand their core values, the things that are important to them, when you're working with folks, do you feel like that is something that people usually come to the table with? Or is it something that they haven't thought a lot about before?
It's pretty much something that they haven't thought about, and it's kind of a new concept. So it's important to really take your time to sit down and figure out what your values are, because if you're not clear on what your values are, we really don't have clear and well-established boundaries.
So I know I'm a former teacher, and one of the things that we did when we were training writing is we would look at essays and we would say, is this a good essay or is this a bad essay? And what I noticed is that the students had a much easier time distinguishing what a bad essay was versus being able to write themselves a good essay. Like, we're critics at heart. It's a natural thing that we do as humans to be able to find flaws or problems within things. So when you're working with someone with boundaries, do you start out with the things that people are not okay with, or do you start out with the things that are just really important to people?
We really just kind of let it come out naturally. And it usually does start out coming out with what I'm not okay with, especially if they're upset about something that's been bothering them. So there'll be kind of, if you're writing a list, there may be a longer list of what you're not okay with and a shorter list of what you're okay with. If you look at it from like a interpersonal perspective versus an interpersonal one between you and somebody else, you're going to have probably the list of values of what I'm not okay with, maybe a little bit longer. But when you're talking about the values for your personal self and your personal well-being and how you structure your life, you'll see a little bit more of what you are okay with.
So in my mind, when I think about boundaries, I think about two things coming up next to each other, right? And I guess, are there boundaries when it comes to only people, or are there boundaries that come to like work-life balance? How do you navigate that? Are people usually coming to you when they need help with boundaries for relationships? Do you find that to be like the primary thing, or is it a variety of things that they need boundaries with?
It's a variety of things. You never know what people are going to come in with, and once they start looking at their values, they actually kind of come up with things that they didn't even think of before. Like I had a one gentleman come in and wanted to set some boundaries with some family members. Is as he was going through the process of figuring out his values, he all of a sudden realized that he needed boundaries with his employees. He runs a business, and he didn't even
Yeah.
realize, wow, this is something that I need. So the whole process is wherever you're starting, if it's with a relationship or with something at work, it's amazing when you start writing down what you're okay with and what you're not okay with, where that leads to. And it's very eye-opening because you're like, wow, I didn't even think of that. And that's important to me.
So somebody listening or watching this is saying, Catherine, I hear you, but I kind of like just want to live my life and let live. I don't need these boundaries, right? That's not me. I'd like to just go with the flow. What's the dark side of not having boundaries in your life, and what can be the consequences when we don't have those core values kind of established at the get-go?
Yeah, that's a great question, Clint. One of the biggest consequences, if you're talking about interpersonal boundaries, is if it's coming up where you don't have boundaries and someone is kind of pushing or manipulating you, maybe even abusing you, is that we spend a lot of time being angry and resentful and frustrated with people. So that's the consequences of maybe not having boundaries in place. So to have more deep compassion for yourself and for others and having a lot of empathy, that's where boundaries really are important. So one of the things we ask you to do is recognize when you're getting angry with somebody. And is that because maybe it's something that they're doing and you have a right to be upset? Or is it because you feel like they're kind of walking all over you and manipulating you? Or if we are feeling like we need to please people all the time and then they're taking advantage of us. And then what you're looking for is the emotions that come up where you're really upset or you're complaining a lot. So that's what we're looking for.
Okay, so when we feel frustrated about the way our interactions are with people, it could be because there's a breakdown in communication where somebody doesn't understand that something is important to us or that something is a no-go for us, right? And so we have to be able to make sure that we're communicating our needs, the things that are important to us. How would that look in an everyday situation when you're working with clients and you're talking about boundary setting within relationships, whether it's a boss and their direct reports, or between two partners in a relationship, or even between friends? How do you communicate it in a way that doesn't come across as somebody who's a jerk?
Yeah, that's a great question. First, the very first thing is we go back to the values because if we're trying to communicate with somebody, we're not really clear on what we're okay with, we're getting ahead of ourselves. Then we can get even more frustrated. So, to answer your question, when I'm talking to somebody to implement a boundary, is I really recommend using an I statement rather than a you statement. So what I mean by that is I'm feeling, or this is not okay with me that you're doing this, where you're calling me at 10 o'clock at night over and over and over again. I'm not okay with that, right? Because what's really my value is really important to me is that's my bedtime. It's important to me to get really quality sleep. So that's a value. I'm setting a boundary. I'm not okay with that. Now, I'm saying the same thing, but how come you're always calling me at 10 o'clock at night? Why are you bothering me at 10 o'clock at night? Okay, I'm saying the same thing, but it's switched to a you. So one's a clear boundary, the other one, it seems like an attack. So that's why it's really important to say, like, know what your values are and then use I statements. It seems to be a kinder way to implement boundaries.
Catherine, the reason why I was calling you at 10 p.m. was to talk about the newest episode of my favorite reality show, Love is Blind. And I thought you really wanted to hear my thoughts and opinions. So why wait to the podcast to be able to bring this up?
I love that you wanted to call me and are so excited about it. But if you're calling me over and over and over again, it's really hard for me to like turn you down. There's different ways to approach it. just depends on who you're talking to, because it's going to be different if you're talking to your partner, if you're talking to a boss. And there's a whole section in the book, The Four Essential Pillars of Boundary Setting, where it talks about ways to implement, because you have different personalities that you're working with. And so if you're working with someone who has more kindness and understanding and supporting of you, you can have a really nice conversation and negotiate your boundaries. If you're working with someone that's more manipulating and controlling, or maybe in a narcissistic realm, then you have to be a lot more diplomatic. The process of this isn't just like a quick answer. It's really getting to know what you're okay with, what you're not okay with, and what the values are, knowing what the consequences are going to be if you don't set the boundaries. And this takes practice. I've written a book. I work with my patients, and we talk about it all the time. But we're a work in progress. It's almost kind of like we're in training, and then it gets easier and easier and easier, and we get happier and happier and happier because we feel more kind and compassionate when we're talking to people.
This episode of Treatable is brought to you by Sandstone Care, which helps teens, young adults, and their families overcome challenges with mental health, substance use, and addiction. They provide age-specific, individualized treatment plans centered around your unique situation and goals, and they only use evidence-based therapies to help you get there. They keep their group therapy sizes small so folks can connect with others going through the same struggle and so that you never feel alone. They also give academic and vocational support to help you improve your grades or to get started on your career path. And lastly, because they know that mental health and substance use affect the people closest to us, they provide support for the whole family through their family therapy program. To learn more about teen and young adult treatment options, go to sandstonecare.com. Change is possible, and Sandstone Care is here to help. So you teased out this book that you have about boundaries and how there's four essential pillars. Nobody loves a framework more than me. Can we just unpack these pillars? Maybe we've already talked about the first one, but I just want to make sure that we're super clear about it. What are the four pillars, and can we go through each one?
Sure. So the first pillar is talking about what are my values, what am I okay with, and am I not okay with. And that comes from Brene Brown's research, if you're familiar with her. And we just built off of that, taking her research and then putting it actually into practice and seeing what happens with it. Then you take those values and then you decide what boundaries you need to have in place, either for you or with another person. The third pillar is consequences. Okay. So this is really interesting, is that if you're setting a boundary with somebody, you have to have consequences. If you're setting a boundary with yourself, like what am I okay with myself, like, going to bed at 10 o'clock or brushing my teeth every day, these are values that I have. If I don't do those, the consequences are already there. The consequences will show up. So there's the difference between, if it's with somebody, you have to set the consequences. If it's with yourself, they're already there. And then the fourth pillar is actually going through like the emotions that come up and the sabotage and how we shut all of this good work down. That's what gets in our way. It's like, I have these great ideas, I have my values, these are the boundaries I want, but it's just not working. And a lot of the emotions that come up is guilt, and guilt meaning like, oh my goodness, I'm doing something wrong. I'm pushing somebody away. People pleasing. If you have the disease to please, that might be something that will bring up that guilt. Because whenever we start to do things that are for ourselves, to make ourselves feel better, happier, it could be, eating better, exercising, working on your mental health. When you start focusing on yourself, a lot of people come in and say, I can't do this because it feels selfish to me.
So it sounds almost like boundaries and goals are really connected. How are they similar? How are they different?
Well, goals are something that we can set, we short term, long term, but goals come and go. Boundaries are more of your values that are flexible, but they're kind of standards that you're setting that you live by. And then it helps you achieve it's what we need to do to achieve the goals that we're trying to reach.
Yeah, and I could see how some goals have an end point, right? If we think about SMART goals, they are the last part of the SMART acronym is timely or time bound, but it seems like boundaries are just things that you're doing all the time. It's not really a fixed end point, is that right?
Yeah, pretty much. And keeping in mind that some boundaries are concrete and we're not going to change those, and then there's some boundaries that are very flexible. We grow, we change. Our life changes, so we can change our boundaries as needed.
Can you give some examples of boundaries that you've seen people say are concrete, this is not going to change, and then some boundaries that you've seen people will change over time?
Sure. One of a good concrete boundary for people, if you're in a committed or relationship or in a marriage, is if somebody cheats on you. Or if you're in a relationship, then all of a sudden they start to abuse you. So a concrete boundary would be the consequences are okay, if you abuse me in any way, I'm out. A flexible boundary could be anything, it could be about your schedule. So I'm pretty strict on my sleep schedule for my well-being, but if I get something else comes into my life, a different job, then yeah, then I'm going to change that. So it's really nice because the ability to have the autonomy to set your boundaries that fit with what works for you. You can see if it works, you can see if it changes. If you get into a new relationship, you're going to have maybe different family values that evolve over time, and those are going to have to adjust accordingly.
So, what I'm hearing is that boundaries are not demands that we make of someone, right? So, a boundary is not a demand saying, hey, you can't cheat on me, but rather it's a condition and a set consequence where you're saying, if you cheat on me or if you abuse me, this is what I will do. I will leave. And then the consequence for an individual boundary or a boundary that is set with yourself are more naturally occurring. So if you choose to go to bed late, I'll wake up tired in the morning. That's on me. But my question to you is when our boundaries are crossed in relationships and friendships, are there any other kind of consequences that we can set rather than just getting up and leaving the relationship?
Well, that's the beauty of it is that that's up to you. So one of the things it says in the book is that you have whatever the boundary is, the consequence needs to match that boundary. So like if you're calling me at 10 o'clock at night and trying to wake me up, and I said, that's it, I'm never going to see you again. That seems a little out of whack, right? So it's important that you, as you're looking at your values, you're choosing your boundaries. You get to choose the consequences. That's up to you. And then again, if the consequences aren't really consequences or they're too extreme, they're not going to match. And then that doesn't make sense. So again, this is a work in progress to see what do I need to put in place so I can live the best life.
So, okay, I want to unpack one other thing from the fourth pillar, which is about going through the emotions. You talked about that oftentimes we will come and we'll set a boundary and we'll set consequences, but then there are these emotions that come along with it. And they get in the way of us being able to either stick to our boundaries or follow through with consequences. I know that you mentioned guilt. Can you unpack a few more of those emotions and what do you do about those things that happen?
It seems like that's the biggest one is guilt. And if we define guilt as like an action, like I'm doing something wrong, and that will arise because I feel like because I'm taking care of my well-being and I'm saying no, this is not okay with me, or this is what I want, this is what's important to me. We feel like we're doing something wrong. We feel like someone's going to judge us. We have been judged. We've been saying, people are going to push back, and it's really hard to stand our ground when someone is pushing back pretty hard. So we feel guilty because we want to be part of a family and a community. So defining the balance of how to be connected with people, but also having boundaries and realizing that is it real guilt? Are you really doing something wrong? Or is it just perceived guilt? So to differentiate between those. The other one that's really common is shame. So shaming has a little bit different definition where you feel like I'm not worthy. So I've seen where some people will come in and say, I just don't feel like this is okay. What will people think? We might have some internalized shames from childhood or just from our culture and how we're supposed to act and behave. And that can really affect our ability. One of the things I had said earlier is it feels like I'm being selfish, someone who's people pleasing, that maybe trying to always seek validation, external validation, then that might be a little more difficult because it's like, well, if I set a boundary with you, then I'm not pleasing you. And then you're not going to tell me that I'm okay and that I'm good enough. So we try to switch that to, in my practice, to work on internal validation to kind of alleviate and get rid of some of that internalized shame. So those are the two major ones that get in the way.
And so what you're saying is that you recognize with some people, depending on how you perceive yourself and how you value yourself, how you love yourself, if that self-love work hasn't been done, if you don't feel like you are enough, you don't feel like you measure up, then that's going to get in the way of you being able to set boundaries because your identity is kind of based upon what other people think of you. Is that the root of it, or am I missing something?
Yeah, that sounds pretty close to it, and it all depends on what your background is and just the way you see the world. That it is, if we're always seeking something external to make us feel good, and that can be in many different ways, then we can sabotage a lot of our well-being just to continue to seek that external validation, and then we lose the connection, or we don't ever develop a healthy connection with ourselves, or we don't really see ourselves, listen to ourselves, and value ourselves. So that's very important to kind of switch that to a more internal validation. And that might be something that we would have to start with before we could even get into the values.
Yeah, that's what I was thinking. It seems like a foundational step. And if I think about relationships, how does anyone know who you are if you're not also expressing your values through the form of boundaries? They're never really seeing you, they're kind of seeing who they want you to be. And so boundaries is also kind of a form of self-expression. It's a way of saying, "Hey, this is important to me. This is something that's a non-negotiable. This is something that is also connected with the things that I think are important." When it comes to the communication side, and it comes to I'm talking to somebody about boundaries, I'm trying to discuss this with somebody, what are the other than the I statements of, "I feel this way, this is important to me," are there any other things that we need to tell people so that we're expressing boundaries clearly?
That's a great question. I think it's being consistent. Because if you're inconsistent with your boundaries, then people are like, well, wait a minute, which is it? We actually already know what our values are. They're really there, but we kind of avoid them. So if you really want to be healthy and go running every morning or something like that, and then why aren't we doing that? All of this is really inside, and it's kind of taking this internal journey to discover that. And then once we discover that, then to be really consistent with it, to say this is important to me to be on this kind of a schedule, or what I'm okay with. Let's say if we're working for a corporation, a lot of people get into jobs and after years they're just like, this just doesn't suit what my values are. What can I do about it? Sometimes we have to stay for financial reasons, but we also have time to sit there and dream and think about what other options. It actually helps us use a more creative mindset to see what other opportunities are, because we just get frustrated or we get sick of what we're doing or sick of ourselves or sick of what's going on. So those are great signs. When you're getting angry and frustrated and sick, we call those sometimes negative emotions, but they're not. Sometimes they're just great messengers that are saying, hey, pay attention. Let's see what is it that I really want. And then you use your imagination and start to create yourself in a way that suits your well-being, your values, your culture, and just the way that your family is. So it's really a gift that we ignore if, like what you're saying, is we're just kind of always looking for external validation.
I really love the way that you put that of using your own type of internal feelings to be able to determine, hey, are boundaries or the lack of setting boundaries a problem for me? Right. When I was a teacher and I would describe boundaries to kids, I would say, hey, imagine if we were playing basketball, but there was no out of bounds, or that there was no rules whatsoever, that you could use stairs to dunk the basketball, that you could foul somebody anytime that they had it, that you never had to dribble actually to get around. Would that change how the game is fun for you? Or would it change the game completely? And they get that, right? Because in order to be able to play and to have a good time with the game, there has to be some sort of structure that everyone agrees on so that the game becomes fun. But most of us are going throughout the game of life, and we've never set any of these rules or communicated them with other people. And so when we go throughout life and we're like, yo, this doesn't feel fun at all, it's because we're playing by a set of rules that we haven't externalized to anyone else. Is that accurate?
I love that. I love that you said that, and that you're, when you're teaching, that you're teaching that to children to give them that concept. Because a lot of us, the older generation, such as myself, we never learned anything like this. We had to kind of figure it out as we went along, or we just, you know, you really feel lost. You feel like you lack structure. One of the things I'll say to people is like, it's almost like a house that you're the house, but it doesn't have a foundation. And then you're just, you don't know which way to turn. It feels scary, unsafe, difficult to negotiate. We can shut down. We can get depressed from that because we don't know what to do. We can shut down our hopes and our dreams and our creativity. And we miss out on the little joys in life when we don't have boundaries because we're so busy trying to navigate something that we don't know. That, like you're saying, if there's no perimeters, what is there to navigate? So, yeah, that's a fantastic way to put it.
The other way that I think boundary setting is helpful is it also gives, as you mentioned, room for creativity, right? Imagine if I asked you to paint something and you said, okay, where do you want me to paint? And I said, anywhere. You would feel kind of anxious. You would be like, on his walls? Is there a canvas I can use? Is there some sort of thing is there a place? When we have some set of area where we can work on, it allows us to unlock our creativity because we have some limitations and some boundaries. And I've seen this with art, especially because when you confine an artist to using a certain type of paint or a certain type of object or a certain medium, then it allows them to really express themselves throughout the limitations of that and to push those limitations to be able to make something beautiful, right? Like I saw a video of somebody who created a portrait of Bruce Lee just by doing karate chops on the canvas. I saw a person who created an art installation just by using Starbucks cups, right? And to be able to put them together and cut them up in a certain way. And because they were limited to a certain thing, it actually allowed them to unlock a little bit of creativity, which it seems kind of counterintuitive, doesn't it? It seems like actually, how could I have more fun or be more creative if I'm limiting myself? But it's almost like it's setting you up for being more successful.
I really think that we do need structure. Sometimes it's someone giving us structure. Some of us like structure. Some of us like to self structure. But within those structures, we all have our limitations. We are, no matter what you're trying to do in your life, we have limitations. We have different limitations. Some people have more limitations than others. So what you're saying is we do have limitations that we have to work within, and we can still be highly creative as long as we recognize those clearly. Maybe we can push those and change those down the road, but absolutely, creativity can happen in any kind of limited environment, and that's what helps push those out of the way, but still feeling a sense of structure. Because if we don't have some kind of external structure, some kind of internal structure, then we feel scared. We may be living another one of the emotions that we were talking about, and is fear. So if we're feeling like we're afraid all the time because we don't have a structure and we don't know where to turn, or we don't have emotional support for ourselves or from others, it's very difficult to be creative or to get into knowing your values. So we have to work on those first. Those are very foundational.
We talk about it all the time on this podcast, how safety is kind of at the root of all emotional and physical healing and growth. That if we don't feel safe, then it's really challenging to do anything. But you mentioned something earlier that I was curious about. You talked about when you were little that nobody was teaching you in school about boundaries. What got you interested in understanding boundaries and kind of developing your own framework for how to coach people through that?
Throughout my life, I was always really curious about human behavior. I mean, I'd hear something and I'd be like, why? Why would they do that? Always trying to study human. And that just stuck with me. As I got a little bit older, I was able to go back to school and to get a degree so I could even continue to study human behavior. But what you do is you start to see patterns of what people need. And then there's other patterns, but this is just one of them, is that the lack of boundaries. And so that just keeps coming up over and over and over again. And then finding a way to really structure it or explain it in a format or a theory so they can understand it. And because one of the questions everybody says, well, how do I do that? And so I'm trying to like put it out in a way that's really easy to understand, in a process that you can develop it. So it's very helpful for the way for you personally. So I've got all of this. I keep saying it and talking about it. I'm like, it's got to go on paper. So when I actually wrote the first draft, I mean, it was just there. It's already there. So it's kind of, this is why I really want to focus on the patterns of the similarities of the problems that we have as human beings. The reason we have our problems in mental health are individual, but human beings are way more similar than what they realize.
Okay, so this makes me want to do a quick section on you might need boundaries. Okay, so what are some common things that a listener or watcher can look for? And if this is the case for them, then they might need to work on their boundaries.
One of my favorite sayings is, and I'm sorry, I can't remember who said this, is, are you living by somebody else's script? And if you're living by what we call shoulding, like I should be doing that, I should be doing this, but it's like looking that you're living about the way it should be or what you think it should be, rather than living by what you really know or you need to find or navigate deep down inside of why we are here. Why were you put on this earth? What is special about you? What path is it that would be most fulfilling for you? And what path is it that we need to be on that can help others? And are we doing that? So those are some of the signs to look at, other than being angry, frustrated, shutting down, having a lot of anxiety. Those are a lot of signs that you may need some boundaries. It's something that I always expect somebody to figure out. And that's why I recommend, talk to somebody, talk to a professional. You can say, hey, where is it that I can get started, and go from there. So that's really important, is to go into that internal deep dive. There's a great Buddhist saying, is the way out is in. And that's where we would start, is to help someone help us turn in. And if we've been traumatized or had a lot of problems in our life, especially when we were younger, that's a pretty scary place to go. And a lot of people spend their life avoiding that, avoiding themselves. That's what substances are for. Those are our unhealthy coping mechanisms that we develop to avoid ourselves. And that's what we're trying to do, is do exactly the opposite, is to stop avoiding and facing ourselves. And then it's very scary to do that. But once you get through that, then you're like, wow, this is great. It's empowering. You get to feel like your authentic self, and then you feel like self-worth, and then you see the world in a different way. You find a lot more joy. And then one of my favorite things is to explain to people is, now you're a role model. You ever thought, like, me, a role model? But yeah, you're a role model because you're showing the ability to change and to find a way that just seems to be a more mentally healthier way to live.
Well said. I couldn't have said it any better. Obviously, the thing that really stood out to me about what you said was talking to someone as a way to be able to understand your own goals and values. Most of us have never heard our own words come out of someone else's mouth. And when we do that, something magical happens. As you mentioned earlier, we're really good at being able to identify things that are wrong. When I taught kids and we would look at bad essays, they were experts at finding things that were terrible, even if they weren't good writers themselves. And so when you can talk with somebody who's a good listener, who can summarize what you're saying, who can identify and reflect back what you're saying about your goals and your values and what you want out of life, it allows you to have a more objective stance and to step back and say, actually, I don't like that. That sounds terrible when you say it, or yeah, that's exactly what I want. And so working with someone like yourself or a real licensed mental health counselor or therapist or a social worker is a great way to doing this because we're meant to do it with other people, y'all. Like it's not something that's easy to do by yourself. But there are some good tools. And speaking of tools, I want to make sure I give a plug for your book. Can you tell us more about your book and where people can go to learn more about you?
Oh yeah, the book is called "The Four Essential Pillars of Boundary Setting," and it's a practice informed, meaning we take the data and the research, and then we use it in the practice, that in the private practice with patients, because a lot of the research and data on theories don't always fit in real life. And then develop the theory from that, and then that starts to develop what your goals are. And your most people's goals when they come in is they want to be happier, they want to have a better life, they want to have better relationships. So this is just one way, one part of many parts that we can approach it. The book is available everywhere, Amazon. It's the first book of a four-book series. The second book is on cultivating gratitude, gratefulness, and graciousness. That should be out by next week. My websites are clevelandemotionalhealth.com. That's the counseling website. And then I have their link. My author website is Catherine G. Cleveland, and that shows you where all the books are. And there's a newsletter in there. So we kind of keep you up to date on what I'm reading, what I'm writing, what I'm interested in, and it's all related to helping people heal and do better in what they want to do better in. So it gives them a lot of resources and links. So it's helping build a community of people that may not have access to mental health professionals or not have the resources to get really good quality mental health counselors that are licensed, as you said, just to give them some other opportunities to learn. And in something like I said, it's really important that this is coming from a practice. So we know that people are receptive to it and it seems to be very helpful. Sometimes I have a lot of counselors and therapists that are actually using the books in their practice. So some of my patients will take the book home and they'll start writing in it. There's sections to write. It's a very interactive book, and then they'll come in and they'll hold the book in their hand. They'll be like, "Oh my God, I just realized this." So it's great. It opens you up, it opens your heart, your soul, and your mind to see yourself clearly and with compassion.
So I'm going to link to all of those things that Dr. Cleveland just mentioned in these show notes in the description box for this video and this podcast. I have one last final challenge for you, Dr. Cleveland. Can you describe the four pillars of boundaries in 1 minute to summarize for folks?
The four pillars of boundaries start out with what I am okay with, what I am not okay with, to help me feel a little less frustrated with other people and myself, to improve my interpersonal relationships with other people, to improve the relationship with myself, and to find joy in the present moment, what we're all seeking. And it just to kind of, alleviate a lot of unnecessary suffering that's going on in the world right now.
I love it. Listen, if you haven't gotten her book yet, make sure that you pick it up. Check out her website, get on her newsletter, because any of the information that she's throwing your way is very practical. It's very grounded in research and in practice actually being done with folks. So you know it can be done with you. This whole boundary setting thing, y'all, it is real. And the troubles that come with it are more common than you think. And with the help of resources like Dr. Cleveland provides in setting great boundaries, it's also treatable. We will see you on the next episode. This episode of Treatable was edited by Daniel Lopez. The intro and explanatory sections of the episode were written by Alexandra Kruger. The theme song was created by Sebastian Gonzalez, and the cover art for this episode was created by Joel Daniel. If you got any value from this episode, it would personally mean the world to me if you would leave us a 5-star review wherever you get your podcast. It helps to spread mental health awareness to more folks, and I read each and every comment that people leave. So tell us what you appreciate about the podcast, and you just might hear us feature it on the next episode. All of my love, and we'll see you on the next one.